Good morning, everyone. I think we might be roughly ready to go. I've got the job of trying to keep this on track this morning, which will be a bit of a laugh, but anyway, we'll give it a go. I'm Julie Russell. I'm currently the chair of CLOA, which I'm going to explain a little bit about, and in the day job, I'm Service Director for Wakefield District Council in West Yorkshire, up north, as some of you might describe it. We've got a number of speakers this morning. There isn't technically time for questions, but we're going to cheat, and we're going to allow a little bit of break, and we might give you a bit of time for some questions as well, if people would like that. I will say it's hard for me to see you all, so when we get to that point, you might have to wave and I will try and point you out to ask questions. So Iain and I are going to open the session on public leisure facilities and how we might move communities, which will really build on the great speakers we had this morning. And then Rachel and then Keith are going to join us in successive format on their presentation. I will let them introduce themselves properly as we go through this morning. Is that okay? Does that sound all right? Bit of a go? Right. We've got a lot of slides between us, I'll tell you that as well. So these will be made available, all right? So you don't need to write lots down. So hopefully it will go well. Okay, I'm going to give it a go. So who are we? So we're CLOA. I hope some of you in the room know who we are. We've got a mission to make sure that we can help advise and advocate for all of you professionals in the sector, really. And we want really every locality up and down the country to have a thriving culture, leisure and parks offer. That's what we want to see. But what we try and do is make sure we, A, support you as professionals, that's really important, and B, we have an informed and coherent voice with our other national bodies so that we can influence government. And we heard this morning from Kim Ledbetter and others about how important it is we do that. We work really closely with the LGA, they're sort of partners in crime, if I can say that, on making sure we have a shared voice. And we'll hint at some of the things we're doing as we go. We are a voluntary executive. We have one paid worker called Heidi Bellamy, who's our policy lead, and we try to make sure we share all our experience and good practice across members. So hopefully what we present today will help you and resonate and give you a hand on the challenges we've got of getting people moving. So I think that's our 5 things we're going to try and cover, and at about after number 3, we're going to try and have a break for a little bit of questions without overrunning. So over to Iain.
Thanks, Julie. I'm Iain Varah. My day job is I'm Chief Exec of Vision, Redbridge, Culture and Leisure. We're a large leisure trust in East London with a turnover of about 22 million. We deliver libraries, parks, theatre and leisure facilities. I think from my perspective, it's got to be about a whole systems approach. It's about how joined up we are. And for me, where it began and where we are now is key. You know, allotment started in the 1730s. Public Libraries Act of 1850 saw 300 public libraries by 1900. And then what we're talking about today, public leisure facilities, one of the first pools and bathhouses was Frederick Street in London in 1842. But by the turn of the century, Liverpool had a baths committee. They had 12 pools. And I guess from there, we've moved on significantly. Obviously, parks and museums at about the same time at the turn of the century. But what they were all about was engaging the working classes, and the opportunity by the vast majority of the population was widely welcomed. The wider role and benefits of movement, I mean, this has been talked about all morning. Everybody is aware, and I'm preaching to the converted. So in terms of that, I guess the key point for me is, although elements of all of this are funded, there isn't a mainstream route for funding physical activity. You know, we all talk about the links with health, the health service. However, when you look a little bit deeper and a little bit further, parks, libraries, theatres are all acknowledged as being funded as mainstream activities by local authority. A lot of those activities are sat behind statute. So the role of public leisure, and I'm just going to pick up a couple of points in here. The point about school swimming lessons, 72% of all swimming lessons take place in public pools. That's absolutely key. 68% of sports halls and swimming pools were built more than 20 years ago, and a total of 30% of publicly accessible pools, more than 1,200 pools, are more than 40 years old. We've got a pool that's nearly 60 years old, still phenomenally well used, but actually getting towards the end of its useful life. Based on the opening and closure rates of swimming pools, Swim England forecast that 75% of local authorities could have a shortage of swimming pools by 2030. I think that's probably the reality, and some of that is more about some of the work that has been done in local authorities, and I know Keith is going to talk about it later, just the whole issue around decarbonisation and the energy portfolio. Again, you saw the social value numbers at the bottom of the last slide. Again, those numbers are well known. It's about action that emanates from those figures. The value of swimming. So the recent piece of research shows that there's £2.4 billion of social value in 2022. You know, it's made up of those circles that surround the 2.4 billion. However, most of the provision of swimming pools falls with local authorities. Local authorities are in a very different place as it currently stands.
Okay, back to me. We wanted to just nudge you all and remind you that although we've been asked to focus on facilities, ultimately these are probably our shared outcomes. I don't think anyone in the room minds where or how people take part in activity. We just want people to move more. And it's important that we recognise that whole life course that was referred to this morning, that it's really, you know, the standards change, the recommendations change, and we need to make sure we build that into our communities. I think we all know this is really complex. There isn't one solution that will get the whole nation moving. Lots of people have different barriers depending on where they are in their life course, and they have different challenges that might mean that sometimes movement's not their priority. Maybe putting food on the plate is for their family. So we have to recognise that, and we have to realise that it's a whole systems approach we need, which was, I think, clearly said in the opening speeches. I've put this slide up there because it's the best one I could find. So whether you're someone in the room that cares about parks or play parks or safe streets for children to play in, or whether you're someone who's running the swimming programme, or indeed someone who works in a school or a GP practice, it's about the whole lot coming together, whether that's families walking their children to school or whether it's elderly folk making sure they can walk to the shops each day. It's all of that that comes together that will help us be a much healthier nation and indeed save that burden on the health service in future years. Iain for the challenging slides.
So, this is what I do on a day-to-day basis. This is, I guess, my bread and butter. That says it all, you know. Expenditure is rocketing. Grant reductions are, grant aid is falling. We are in a very, very difficult time. You know, I talk to my senior management team. We've seen what's happened with salaries, utilities, chemicals, supplies and services. Income hasn't increased at the same rate that all of the expenditure that we spend on a monthly, yearly basis has escalated. You know, I'm sad. I can tell you what the current price of electricity is, what I was buying electricity for 3 years ago, and what it went to last August. So at the height, we had a new facility. We were buying electricity at 82 pence a kilowatt hour. Before that, the price of our fixed price contract that was still in, 21 pence a kilowatt hour. And today, I can buy for about 28 pence. 20 years ago, I couldn't have told you any of that information, but the focus is, you know, very, very specific. Changes in local authority spending. As a trust with a whole range of services that cost money, originally when we transferred, the council was paying us £15 million a year. They're now paying us less than £8 million a year. And part of that is around what that graph shows you, just in terms of what the local authority spend is. And there we see more. And the key to that is, I think, central government grant, where it clearly shows a decrease of 60%. Every authority is looking for commercial opportunities. Every authority is looking to squeeze assets, and in order to do that, they're making some difficult decisions, which are some of the traditional things that we've always delivered. They are making decisions that relate to social value, inclusivity, some of the issues around who we target to use all of our facilities. And I think in the first speech this morning, there was reference made to some of the authorities who've had a Section 114 notice, Birmingham being, you know, the biggest local authority in Europe, and in a situation where you could argue, through no fault of their own, a massive equal pay claim. They're now in a position where they've got a very, very focused lens on a whole range of services and what they provide in the future. I know there are 100 local authorities who are teetering on the brink, and a significant number of those local authorities are in London. You know, you get a whole range of issues around immigration or social care, and one child in a care placement could be £1 million a year. And I guess, lastly from me, is the message around, you know, where we are in relation to swimming pools. If you look at the north-south divide, when you come into the south of England, most pools are generating a small surplus. My personal example would be our leisure facility portfolio was generating over £1 million a year in surplus that was subsidising libraries and parks. We're now in a position, having recovered from COVID, where we're in a position where actually that £1 million gone down to 500,000. So we've had to squeeze a whole range of other areas. And I think there's a bit of a debate about, well, where are we and what the strategic view is in relation to developing, delivering swimming pools when Sport England and Swim England are basically reliant on local authorities. But for me, there's a bit of an issue that, well, actually, they might be reliant on us, but there's no recognition of that.
Thanks, Iain. So, referred to this morning, key government strategy has come out, absolutely recognising that divide in participation, that we have got so much more to do. Although overall numbers may have gone up over the last decade, who takes part is not where we want it to be, and for many of us it doesn't reflect the places that we represent. So if you overlay that to what Iain's just said, we've got declining resources overall as a sector, but the people we want to reach and encourage to move more are harder to reach, and by default are probably requiring more resource to do so. Mentioned this morning, I think for me what this really shows is, whilst we've still got a lot to do for inactive adults, to be honest, the graph that breaks my heart is the one on children, which says that actually we've got less active children coming through. So if you look at our generation or generations, we already have an inactivity problem, and yet we probably had more active childhoods than many do today. So we're building up a problem, aren't we, really, which we have to get underneath. Really encourage you to look at the detail in here and also to apply to your place, because this does vary depending upon your place. And I guess what we're all trying to do is make sure that our participation is representative of the place that we're there to enable and support. And really interesting when you get to people with disabilities. Certainly in my place, 31% of individuals are likely to have a disability, and you can see from those stats that 68% of those individuals will not be taking part. So really quite challenging in that sense. Before we go into the next bit, are there any particular questions about that? I can't see you all. Or are everybody happy that we move on to some top tips? I'll move on. Okay. So from CLOA, we've sort of had a bit of a brainstorming session at the first executive meeting, and we've come up with some things that we think might help you. survive and thrive, because I think that's probably where we are. I'm going to be really quick on these. So the first one is, have a look at the public leisure facilities document. It kind of comes up with 7 blobs or 7 squares, and I would say that they overlap at times, but have a look at them, because each of them will make sure that we can evolve as a sector, we can transform, and slightly pivot to that health agenda if you're not already. I think many of us already are there, but there is more to do. High quality place data. How many of you have got a well-informed facility strategy in your place? Yeah, okay. So there is a Sport England facilities model. It has some real strength in it, but sometimes when you're under the cosh, which is what happens in budget rounds, it's incredibly hard to gather the data you need and the insight. So if you haven't got time for that, please look at any spatial mapping you have, any deprivation data you have, all of your usage data, and really think about how we can engage those who aren't active. If they're not active at all, they have to be your target. We absolutely need to get people moving more. And there's just a few examples of the data you might pull. A bit of a plug for Moving Communities data. If you're not yet on the platform that's informed all those social value figures, please try and think about how you might inform that data, because that data nationally is what we are wholly reliant on really to inform government. So the more people in it, the more people sharing their data into the system, it's all protected in the right way for you, the more impact we can show government right through the whole of England and Wales. Partnerships, okay, really important you work across your authorities and in your communities with those partners. We have nationally a local government physical activity partnership. It's chaired by a colleague from the exec. We have all of the key national characters around there from Sport England, from LGA, and we are working really hard to make sure that government hear that. It was probably the action of that group alongside LGA that led to the crisis money for swimming pools. So it does work. We just need to have a coherent voice. Please make sure you're thinking of the non-obvious partners. Often they're the ones who can reach the inactive for us and join forces and be the solution to people's needs, not the challenge, if you like. Low carbon provision, I'm not going to say too much on this. We've had quite a lot this morning, but it absolutely makes good sense. But I know many of you will be faced like we are going, it costs how much to change it? Because that's where I am. And if you can't find the capital, it does become challenging. But work with your environmental teams, if you have them in the local authority, and find little ways, if you can, to make a difference. Because in terms of energy costs alone, let alone looking after our environment, we need to do more, and particularly with swimming pools, I think, or any place that you're cooling as well. We often forget that our nice ventilated gyms that we've all become used to are also burning fuel, like Billio. And certainly that's something that we're beginning to think about. In the olden days, if you can remember it, we used to open windows. Do you remember those days? Good old windows, just open them. There's lots of advice on this, both through CLOA, APSI, Sport England. Have a little read of it and seek help, and I thought the advice this morning was really important. Leadership and workforce. So my first line on here is really important and close to my heart. I get really tired of people telling me that it's okay to subsidise parks and drugs, prescriptions and vaccines, but they don't want to subsidise leisure. And the more we don't subsidise leisure, the more that the very people we're worried about don't access it. So be strong, be a strong leader to articulate with all the data you've seen today that we deserve to be subsidised, particularly in communities of need. This is the wonder drug. There isn't a better one, it's been proven. So let's be strong about that as a sector. Be proud of it. We're funding prescriptions, we're funding GP hours when they have to meet with people, we're funding all those things. And parks often we fund, interestingly. But when it comes to a leisure centre, everyone wants to whack an income target on it, don't they? And that, the very point of that income target means that those that are at need don't get to access. It's completely inverse to where we need to be. Maximise the use of free training. If you're someone who's come into the sector because you've been progressed and you're grappling with it, there's free training for you and your elected members through LGA. They're really good courses, they're free. Please encourage you and your teams and elected members to get involved. And we're also going to have a case study a bit later about the Manchester model. They're doing some brilliant work around encouraging leisure staff to sort of pivot their thinking around engaging their community. We create health. People keep using the preventative word. Yes, we do that too, but we create health, and remember that every time you open your doors, you're creating extra health. Meet with your Director of Public Health. Knock on their door if you're not there, and the Adults and Social Care Director, anyone that you know is trying to manage demand through health. Go and find them, be a little bit of a pain, and make sure they're a regular slot in your diary. And if you do have a partnership or a network meeting around the agenda, get them along and work it around their diary. Make them special, because actually you're a real solution to their problems. The last point I've put on is because we're not always clear on the evidence from our sector. You've heard loads today that shows it's there. Do use it, but make sure your programmes are effective. Because sometimes we're a bit guilty where we've suddenly realised that maybe our referral programme or maybe the holiday club for children suddenly drifted towards the wealthy children and not the ones on free school meals. All that stuff that sometimes happens when you're not amongst your data. Do look at it and make sure you play it back appropriately. Be inclusive, reflective of your place, and really try and hold your own when people are wanting to increase income targets and all those things. And don't be bound by your walls. You might be a facility manager, but ultimately it's the people who aren't coming in your facility you need to worry about. And maybe how you can reach those people is probably something we need to think more of. Political capital. We can be a good thing and a bad thing, can't we? But generally at a local level, local members love you. They don't want to see their facility go. Make the most of that. We've got strong political capital, probably particularly in sport and leisure, more so than culture. So make the most of it. I think someone said this morning, get to know your local members. They are a representative voice of your community, or should be, and we should be proud about what we have to offer. If it's a bit old and a bit tired, stand by it really, whether that's a play park or a leisure facility or a cycle path. Shall I do this one? So our first case study, quick pace, is have a look at the Manchester work. At the end of this PowerPoint, there'll be some links, and click on them and see some. This is some really good work, that's really a whole systems approach to getting all of the staff in leisure thinking about health. One single vision of improving the population health, that's what they're there about. And by really just focusing, it stops us looking at the bottom line all the time. As Iain says, we get attracted to the bottom line financially because we're worried about it, but we need to focus on health and make sure that works. And they've done some really clever work to roll that out, which is really important. So even our lifeguards and leisure attendants are getting that education about why we need to be in that business.
Thanks, Julie. Building resilience and co-location. And I think the key bit for me is this isn't new. You know, there's many examples from the 1890s, 1900s where swimming baths were built next to libraries, were built next to education establishments. Moseley Baths and Libraries, probably one of the key ones. And that operated for many, many years on a co-location basis. We then moved to the 2000s and there was high-profile new builds. If you look in London, Eltham had a health centre, a library and a leisure centre, all with a central foyer. What they didn't do was integrate those facilities, so you had library staff and leisure staff, and actually there was no integration. But that facility and a whole range of other facilities that were built in the early 2000s are still working exceptionally well. We've seen very recently a move back to joint use. You know, Birmingham started this in the early 70s, but actually you look at some fantastic new buildings, and I guess my example is Ponteland, which is in Northumberland, which is a joint use facility where you've got a secondary school, a community school with over 1,200 pupils, a fantastic leisure facility, soft play, sports hall, you've got a library, and then you've got a whole range of outdoor sports clubs, so a rugby club and a football club, all using that building, which in effect was funded as a school facility. And then I come back to my example of integrated staffing, where the economies have put us in a really difficult position, where with two of our branch libraries that in effect were costing a couple of £100,000 a year, we freed up back office space, we put a studio in, we put a gym in, and all of those facilities now in effect are cost neutral. But the key bit to that, we trained both library and leisure staff to work across the facility, and actually that has probably saved us as much money as co-locating with separate entities. really, really difficult to do when we still struggle, even though these facilities have been open for 4 or 5 years. But it's definitely worth trying to get there. And you do get benefits, especially when you bring in the art and cultural staff into that environment. So if you become much more joined up, I think that is the way that we're heading. We've got a big team of health and well-being staff who work across libraries, across parks, and across leisure facilities. And actually, by being joined up, makes it much more difficult for the council to make the sorts of decisions that we're seeing.
One more. Many of you will probably have elements of this work where you've integrated pathways into your leisure facilities or your leisure service. There's some great examples of real evidence-based work to help people with particular conditions. When I first came to the sector, I think we were only ever talking about cardiovascular health. Certainly in my local referral scheme, there's a whole long list of conditions now that we receive referrals from because the evidence is there that physical activity makes a huge difference. And we're able to show back to the public health team or the providers and commissioners in health that we're making a difference to those people's lives. The Stand Tall one as well from West Suffolk's really interesting because that's actually about young people and their mental health and wider support. So lots of great case studies for you to have a look at. And I think, again, the more you can evidence those back to your mental health providers or your NHS providers in what are quite complex integrated health systems, the value and impact of those is pennies compared to the scale of their budgets. And therefore it's really important we keep encouraging that we can make a difference to those issues. There's a slide at the end of here, lots of further resources. Some of them have got really nice little videos. If you're really time short, click on the videos and hear from people. And I think the other thing I'd like to say to you all as professionals in the sector is, as a CLOA exec and network, we're really keen to hear from you up and down the country. We want to be reflective of all of our geographies and reflective of our diversity of those geographies as well. And we're always keen to hear new voices. So I've just put that on the end. If you're not a member of CLOA and you'd like to get involved, please do. There's an organisational option as well as individual. But above all, we want to make sure CLOA is reflective of local government up and down the country so that we can help everyone have a really thriving offer. So I'm going to finish there. I will take any brief questions if we can for Iain and I. I'm just looking before we move to Rachel. Oh gosh. I'll just say one in the middle there, sorry. Yes, perfect. Yes.
Just a quick question. What is the Section 114 notice?
Great question. Go on.
It's the equivalent to a local authority becoming bankrupt. So Birmingham is the current example where they had an equal pay claim of billions of pounds, which meant that it put them in a position where they couldn't balance their budget. Local authorities legally need to do that, and now the government's bringing in commissioners to work with Birmingham as a consequence of that. But there are 100 and odd authorities who are all on that precipice at the minute.
It's probably worth adding that there's a real danger for our sector in that, of course, because there's been a lot of press about what is statutory for local government and what is not. You might have heard some headlines. I'm not sure that's a very easy question to answer, given the value that people play on their parks, their open spaces, their leisure centres. I think it would be a very sad world if we weren't offering those. I don't know who else is going to fill the gap. I don't see any private sector folk wanting to fill the gap of that, do you? So it's very interesting, really. I think there's a question here.
You just mentioned obvious partners to get in touch with the inactive. Have you a list of people that you'd use to get in touch with people that are inactive, not the obvious ones?
Yeah, so for me, depending on the scale of your place, it's really important to work with some of the organisations like Age UK, local charities and community groups, the sort of organisations who are working with a different demographic sometimes that what might walk through the door of a leisure centre. It could be youth clubs, it could be some of our disability style groups as well. I think the key is to find those partners really at a granular level. If you talk to public health colleagues, they often talk about a micro neighbourhood level, because that's where the information is of the individuals you're missing, and often people are missed through lots of different reasons. So, and you'll see Sport England doing this nationally, of course, now. They'll be working with organisations like Undefeatables, with campaign, so they're making sure that the audiences we know are less likely to take part, there is more work with them. So that certainly generally the sort of charitable sector organisations on your local patch are often the ones who are reaching sort of quite granular levels in communities. And for me, that's how we've changed our sort of thinking. We're doing a lot of work locally around place-based thinking in neighbourhoods, and it's about, you know, where can you move with those neighbourhoods to build confidence and encourage some enabling work to, you know, we can't deliver everything. It's about growing how those communities can help themselves often. Does that help?
Is there time for one more?
Yes, I'll take one more there.
Could you explain how activity and outcomes at centre level can feed up to, say, directors of public health? Because we heard how that sort of discord filters its way out.
It's a difficult one, and I think for me it's about how integrated my organisation is, where we've got a health and wellbeing team who work hand in glove with, in effect, leisure facility managers. So our group exercise manager works for health and wellbeing, but sits on the leisure centre manager's bi-weekly meeting. It is about integration. And it is also about relationship with public health. So if you look at the broad range of schemes that we've got that are about integration, public health probably invest about £250,000 in a whole range of schemes. And for instance, our GP referral scheme, in effect, gives the individuals who are on it access to leisure facilities, access to walking groups in parks. For me, it's about the whole integration picture. And just to plug what Julie was saying, if you have a look on the GPAP website, there's a couple of videos from my organisation that just explain that in a bit more detail.
Worth saying the point about knowing your Director of Public Health. Most modern Directors of Public Health absolutely love our departments because we have legs. We have legs in communities that they don't. They're often an academic commissioning team, and therefore how you can help each other is very, very powerful. And it's often better to have that conversation before money, and then you can build that relationship if you're not in that space at the moment. So I think we're going to have to stop there, as I'm very naughtily taking Rachel's time. So we're going to move on to Rachel, and I'll let Rachel introduce herself if that's okay.